Hello, and thank you for tuning into Lakeland PBS to learn more about the coronavirus pandemic that's sweeping across the world and disrupting everyone's lives. My name is Bill Sanford, and I manage Lakeland PBS, and I'm here with Susan Jarvis. She's the president of Sanford Health of Northern Minnesota, and we have Dr. David Wilcox with us as well, the Chief Medical Officer of Sanford Health of Northern Minnesota. Thanks so much for being here with us. We have a lot to cover in the next half hour, so why don't we get started right away. I've heard a lot about the coronavirus, and people compare it to the flu. But it obviously is really different than the flu. Can you tell us a little bit about the virus and where it came from and how it's, doing so much more damage than other viruses in the past?
Absolutely. Coronavirus, just to clarify a few things, isn't really caused by anyone or, came from somewhere special. Coronavirus is really an accident of nature. Our immune system is seeing something new. Viruses are pretty ingenious. They have learned how to invade our body, get into our cells, steal our DNA, use it to reproduce at millions of copies, and then make us sick with pain and coughing and sneezing. That spews this virus into the environment for someone else to have the same problem. And so just by an accident of nature, the genetics of that virus have changed. And now it's acting differently than before. Coronavirus is very much the same as the common cold. There's many different kinds of coronaviruses, and we get coronaviruses in our lifetime. Everyone will have had one and probably gotten over and probably had another one. So that's just to clarify what a virus is and what coronavirus is in particular. This one seemed to be able to move from animals to people and is spread wildly. It's spreading because we're not used to it. So I'd like to talk a little bit about relationship to influenza. Influenza is also an annual epidemic that we're very familiar with. It's not new news, but it's still quite deadly news. I'd like to show you some facts about how pandemics spread. So influenza so far this year is still the biggest epidemic killer in the world. We're familiar with it because it's not very dangerous. About 1/100th of a percent, 0.01 people who get influenza will die. We know it's dangerous. However, when we compare it to other epidemics from the past, you can see Ebola from the past was very deadly. More than half the people die of Ebola. Although it had a lot of media and it's tragic, it did not have a wide spread. There was just a few thousand cases. Same with MERS, which was also a coronavirus. That was more deadly than the flu and more deadly than SARS, and you can see the facts and how the percentages of people could be expected to die from these two viruses. COVID-19, so far, compared to the others, is widespread. This virus is quite smart. It's learned to move from person to person and spread quite quickly. But across the world, as of the last data I know, so these numbers are changing every day, but the last data so far is around 230,000 people affected and about 9,800 people dying, which has been giving it a death rate of around 3%.
Interesting. With this virus so new, can you explain how people get the illness and what symptoms they might have? Absolutely.
It gets spread by droplet contamination, just like the flu or the common cold. Someone who's sick has been triggered by this virus to sneeze or cough. That droplet gets on a surface or gets into your body through contamination with your hands or getting into your eyes, nose, or mouth. Then it infects your body and you become ill. We know that this can last on hard surfaces for quite a period of time, so we ask people to clean those hard surfaces regularly. But that's basically how the common cold spreads. We've probably gotten lazy over the years because we've had antibiotics present for most bacterial infections. We've had vaccines for infections that we understand that are viral, but we don't have a specific treatment for coronavirus to this point.
Okay.
We do know, Bill, I'm sorry.
No, go ahead.
We do know that, unfortunately, of all the people that get coronavirus, about 80% will have mild disease like the common cold. About 15% will end up in the hospital. About 5% of those people will need to be in intensive care, and some will need to go on a ventilator. And unfortunately, if you get to ICU, about 1 in 5 of those people in the ICU will die of this disease. So we can use those to judge what we need to care for our community.
Okay. Interesting. I'm going to throw another question in here. Many people work in jobs where they're required to be around a lot of people. You look at the grocery stores, the different businesses now that are really getting inundated with folks. The people that work there, what can they do to stay healthy?
Well, the term we're talking about is social distancing, and we'll talk a lot about that in the future. But same issues. If you're sick, stay home so you don't give this disease to others. Maintain your distance, wash your hands, cover your cough. It's very basics of personal hygiene that we've all known work for a long time, but of course we're all scared and reminded to do them at this time. Okay.
With folks feeling anxious about the spread of this in the U.S. and now in Minnesota, what is Sanford Health doing to prepare to be ready? I was talking with Susan a little bit before we started, and the fact that it's kind of nice being in a rural area because you can kind of see what's happening, and you got a little head start where the big cities kind of got slammed. So where are you guys at, and how are you dealing with this and getting ready?
Well, at Sanford Health, we have a committee that we call the Sanford Emerging Threats Team. And the Emerging Threats Team is enterprise-wide for all of Sanford and is a team that's been stood up and activated for many, many years. So that what we do with that team is we monitor outbreaks across the world. We monitor, for example, one of the more recent times where we had to really do a lot of monitoring and preparing was for the Ebola outbreak that happened a few years ago. Where many of our hospitals had specific units where if we were to get a patient that had Ebola, where those patients would go and how we would care for them and things like that. So we always have that underlying level of preparedness so that we're looking out for what's on the horizon and making sure that we're prepared. With this particular pandemic, we've been planning pretty much from the time we started hearing about it back before the first of the year. We started meeting more regularly. Our Emerging Threats Committee started meeting more regularly. We started looking at inventorying supplies and other things that we might need and looking for any areas that we might need to concentrate on to be able to respond should the virus continue to spread and it become worldwide, which it has now, as you know. So some of the early things that we did we started asking people when they came in for appointments about travel, and so we started screening people right when they came in and checked in for their appointment to see if they'd traveled to any locations where the disease was at the time. That's one of the early things that the Emerging Threats Committee put into place. About 2 weeks ago, as the virus continued to spread, started to be in the United States, those few cases that started, we activated our incident command structure. So we have an enterprise incident command. So we have an incident commander, and then we have people who are in a room that are monitoring things and sending out communications and making sure that we're prepared from the enterprise standpoint. And then we also activated our local incident command structure. And so with that, we have been looking at our supplies, monitoring our inventory of different things, looking at how we can expand bed capacity if we needed to expand bed capacity for patients that are coming in, looking at what training we might need to kind of ramp up for staff and people that are involved, looking at what kind of information we need to get out to the community and to our staff and things like that. So we've been pretty active for a while now and in the preparations for this, and we feel like we're going to be able to do what we need to do for the patients that we serve.
That sounds great. We were chatting a little bit before we got started here, and I think you'd mentioned that there are no confirmed cases right now in this area. Is that right? So that's good.
Yep,
that's
absolutely.
Good to know.
Through our testing protocol, we've managed to test about 19 people, so we're testing some. We have 4 negatives, and we have a few out there that we don't have results. You've heard about the issues with supply and test turnaround.
Right.
So those people are all being monitored. They've been isolating at home, and so we'll see how that spreads. Our expectation is that this will come. It's just a matter of how and how fast.
Mm-hmm. Just so people can understand the testing process a little better, we were chatting ahead of time, and because I was asking a lot of questions too. Everybody's got questions about this. It sounds like right now, when people get tested, the tests are sent away, right? So most of the hospitals around the area typically and clinics can't do the test internally right in their place to get a positive or negative. They have to send it out. Is that right?
That's correct. And if you take a look, we have a tiering system for doing an indicated test. We have a set of symptoms. We have some of those to remind our audience what those symptoms are. We have a slide that I'd like you to take a look at just to remind our patients. So the first step is, do you have symptoms of COVID-19? And if you don't have any symptoms of this disease, it's not an indication to do a test. Just like if you don't have any symptoms of influenza, we don't test you for influenza. So the next step is, have you been exposed to a patient known to have COVID-19? Or have you traveled to an area of high risk? And so far, those are designated by the CDC, and those areas of high risks are essentially outside of the United States. So that's the protocol that's recommended and that we follow. So just like influenza, you may not need a test if you feel well. If you're sick with body aches but no fevers, that's not the symptoms of COVID-19, and so you wouldn't qualify to have a test in that case. This will change rapidly as we follow what we consider our source of truth, the CDC recommendations.
I would also say that as far as the testing site, so right now in the state of Minnesota, the Department of Health is running tests. And then also we are using another laboratory as well to run tests. We do hope to have our own testing up and available within Sanford within the next several days.
Great.
So that will be really good. We also ask if people feel like they have been exposed and are not feeling well and are asking about whether they need a test. We ask for them to call into their clinic, and they'll be screened and then instructed as to where to go if it's determined that they meet criteria for testing.
Great, great. So people obviously shouldn't just rush right out to the clinic. They need to call ahead of time if they've got concerns and get screened and talk it through to make the decision about how to best move forward. Right?
Absolutely. So it's not, not really a good idea to just come straight to the emergency department or come to the walk-in clinic if you're not feeling well and you're concerned and feel like you need a test. Okay. Obviously, if you're having an emergency, we want you to come to the emergency department, but we do want to save that resource for people that really need it. So we'd like to screen you on the phone and then instruct you where to go.
Sure, that makes a lot of sense. I think a lot of people are concerned. Everybody's a little bit paranoid about this, and if you start to get some sniffles and a sore throat, it's like, oh no, and a lot of that can be just a common cold or anything else too. So, I think it's probably in people's best interest to, if they're concerned, call and have a conversation and get some medical advice. So thank you for that. This has been in the media a lot, and. Is there anything more that you'd like to talk about? We've talked about the testing. How sick should someone really be before they get tested? I think you kind of went through that. What other information would you like folks to get?
I think we want to talk about flattening the curve. And why are we hearing all of these either requests or mandates from the government and others asking us to social distance or to We're restricting visitors now at our long-term care facilities. Basically, there's no visitors allowed. Why are we doing things like that? We're also restricting visitors in the hospital to 1 with people that come to the hospital. Why are bars and restaurants closing? Why are we doing that? And so it is, and if you've heard any of the news lately, it's all about flattening the curve. Mm-hmm. And so there's concerns about this virus and how it's affected other parts of the country, of the world, especially in Italy, where the virus took off very, very quickly and has really caused issues with the healthcare system, so that resources are scarce, and it's just been very hard. So we want to prevent that from happening here in the United States. Mm-hmm. So it doesn't mean that people aren't going to get this virus. It's very difficult for us to completely stop it, but we just want to slow it down. Sure. So that we have the resources that we need to manage it and to take care of the people within the healthcare system. Okay. So that's why the social distancing, and that's why it's so important for that to happen.
So do we know yet, is this any more contagious than the flu or anything like that?
By a small degree, it's actually a little less contagious of the flu.
Really? Wow.
But it's a much more serious illness.
Right.
So again, this isn't a yes/no answer. It's a matter of degree.
And there's no vaccine yet, so
Right.
we're able to mitigate some of that with the flu, the contagiousness with the flu, because people get the flu vaccine.
I've heard that maybe elderly people that haven't been vaccinated for the flu, that might be a good thing for them to get done, so that you're not dealing with those problems too, in addition to this, if this blows up in our region, right?
Absolutely. It's confusing because the flu and COVID-19 are very similar illnesses in how you feel. As you can tell, the flu is a serious killer every single year, and it is something we know about and can prevent with flu vaccine. So it's never too late to get your flu shot.
Okay. Okay.
My analogy for the flattening the curve would be this. You and I might want to have 100,000 pizzas delivered to the studio by the end of the show, but everyone would understand that that might be really hard to do. And as far as flattening the curve, if people don't maintain these social distances, it's essentially delivering everyone who's sick with a pretty similar pattern. Within 5 days of exposure, most people are getting sick. And if we do that across the country, we'll quickly overwhelm our healthcare services.
Sure, sure. Jeff, how are we doing for time? Okay, we've got some more time, so let's. Is there more information that you'd like to give to folks?
I think it's important. We've seen a lot of people going out and stocking up for 2 weeks or however long, and things that are that people might need are not available in stores, and so it's important. I think that our slogan is facts over fear. So the reason people are being asked to stay in for 14 days or however long that might be is because we want to flatten the curve and we want to social distance, and that's the way to do it. But there's probably not a good reason to buy 18 months worth of toilet paper. I think you can probably buy 2 weeks worth of toilet paper, and we think we'll be okay, that we'll be able to get back out there and do what we need to do to keep life moving on.
Okay. Yeah. I think I've heard from a lot of folks too that they're kind of nervous about the fact that they can't buy hand sanitizer. It seems like it's off the shelves everywhere, and antiseptic wipes. But just good hygiene, I think, is a big thing, right?
Soap and water works just as well as hand sanitizer.
Okay.
And there's lots of soap in the stores I've been to, so I don't think there's any reason not to wash your hands.
Absolutely. Americans aren't really used to working with the idea of scarcity, and so their response to that is hoard. And as you can see, it's affecting our region.
Sure.
Checking out the wallpaper.
Yeah.
This is really unusual times. I think back of when citizens have been asked to do something that affects their personal life, like in World War II is the last I can remember, tales from my parents in my early life when they were asked to not use rubber and ration gasoline and save silk stockings and all kinds of things that affected their personal convenience. This time we're asking citizens to do something very personal, which is to give up some things that they love to do, gathering with their friends, going to their churches. We've asked incredible things of our businesses to shut down for a period of time. And this is really about the greater good. People have asked me my biggest fear. My biggest fear is not that healthcare doesn't know how to manage infection. My biggest fear is not that we have adequate protection for our employees and the ability to manage this. My biggest fear is that our citizens don't take on these personal choices to distance themselves, to not go to gatherings, to not wash their hands and cover their cough, and still choose to go to work when they're sick. That's my biggest fear, because that could overwhelm our system. And we have the entire capability to do this. We can't do that all at once, just like we probably can't get 100,000 pizzas here.
Sure. So
in the next 10 minutes.
People just need to be smart about this and just take the advice that they're getting.
Absolutely.
Stay away from other folks. Try to resist the urge to shake hands, which is almost impossible, I think, when you meet new people. But so I think those things are really good. And people can be a little creative too. We have reporters out in the field every day, and they're using equipment and microphones that are in people, that people are breathing on. And so, we couldn't get any wipes, so I went to the hardware store and we got some isopropyl alcohol and we mixed up some stuff. And, I think people can be a little bit creative too. What is your take on, I've read that if you can't find sanitizer, you can mix, as long as you have at least 60 to 70% alcohol, with some aloe vera gel to make hand sanitizer. Is that
I think that's reasonable.
People can do?
Just like you, I have a bottle of alcohol at home, isopropyl, by the way, and we're using soap. And actually, I can't quote you the study or the time or the distance, but just rinsing your hands with water for a period of time and rubbing them together has an activity that will eliminate or reduce infection risk. And so that alone, if you don't have hand sanitizer, beats nothing. Beats coughing into your hand and then not doing anything. Right.
So again, I guess the big thing is to remind folks, to stay home if you can. Don't feel the need. I know it's difficult and people are used to being able to go out and mingle with their friends and go to movies, and now's maybe a good time for family,
I think it's important, like you said, if people are sick, they definitely need to stay home.
Mm-hmm.
And as Dr. Wilcox said, most people, this is going to be very mild. There's, 80% of the people that get this are not going to require hospitalization. Some won't even know they have it. Many will just have mild symptoms and they'll recover.
Mm-hmm.
We're concerned about those people for sure, but we're especially concerned about those patients that are going to need hospitalization. And so staying home and drinking plenty of fluids, taking something for your fever, that kind of thing, and monitoring your symptoms, mm-hmm. and calling your healthcare provider if you feel like you need to be seen, and then pre-screening before you come in.
Maybe we could talk just a minute. I mean, if somebody in your family is having those symptoms, but they're not sick enough to go in, how should the family interact around that? Maybe you can give us a little advice for that.
That's a really good question.
That's a great question. It's the same issues that you would do normally, but we get lazy because the flu's not very dangerous.
Mm-hmm.
But you should isolate that person in a room. If you have access to a mask and they're going to be out in public, they should get a mask. As long as the person is isolated and everyone else is washing their hands and that person stays in their room, that 6 feet has science behind it. The droplets that spread this are big enough to fall to the ground within 6 feet. So that social distancing, even in the home, keeps people safe. I'd like to have a call out to young people. The message has been that young people don't get this disease or they don't get very sick. And in fact, they do get this disease. I think plenty of young people have had the flu and understand they're miserable. But their parents might be at risk. Their loved ones might be at risk. And if they become that person who's been out in public and has contracted this disease, they become the vector, the person who brought that disease home for someone who may not survive. So I'd like to really clear up that misconception that if I'm young, this is no big deal.
Also, if you are out and wearing a mask, you should only be doing that to go to seek health care.
Absolutely.
You should be at your home.
If you're sick.
If you're sick,
yeah.
yes.
And the CDC has made strong recommendations that masks do not help people who are well. It's the sick people who need the masks. It's the caregivers that need the mask. Masks are not particularly comfortable. When you have a mask on, you're doing exactly what we ask you not to do. You're fussing with it, and you're messing with it, and you're adjusting it, and there might be contamination on the outside that you'll introduce to your eyes, nose, and face at a later time. Okay. So those are misconceptions that we really need to straighten out.
Okay. Well, that sounds great. I just want to remind folks, too, that this program will be on our website at lptv.org, and we'll certainly give the link to Sanford Health, and so folks can share this with their friends and tell them where they can get this information. We've just got about a minute left. Any closing things you'd like to remind folks about?
I would say there's many places that you can go to get more information. A couple of those would be if you are not subscribed to Sanford Health News, mm-hmm. there's things that we're posting regularly. And we also have a Facebook page for Sanford. And then we've been working with Beltrami County Emergency Management. They have a page as well as the Minnesota Department of Health. And the CDC website is really good for information as well. And then it's just really important that we understand this is an opportunity for us to come together as a community to beat this. and it's a challenge for us that I think we're up to the task for.
Absolutely. And if you normally wouldn't go to the doctor when you're ill, you don't need to go to the doctor now if you have cold and flu. We're asking people to call. That helps us hear what your symptoms are. It helps us sort through whether you need to get tested, whether you need to go to the doctor. But if you're ill with flu symptoms, you should have stayed home for influenza, and you should stay home for COVID-19 if you normally wouldn't go to the doctor. So please call our services and your doctor and make sure they have some questions for you and can tell you what to do, as opposed to immediately coming in.
All right. Well, I think we're going to have to wrap here based on time, but I just really want to thank you both for coming in. I think this is great information, and we're really pleased to be able to share this with folks. In closing, I'll just say, wash your hands, maintain that 6-foot distance, and be safe. And thank you so much for tuning in.